Good morning. First of all, thank you to the IOM, to Marla, to Patricia, the whole team for the opportunity to be part of this work and part of this event this morning. I'm going to provide a very different starting perspective, which is how do we think about this issue from the perspective of health systems and strengthening of health systems. And hopefully over the course of the next few minutes, what you'll see is that whether we're coming from a starting position of women's empowerment or health system strengthening or impact investing, that where we're getting to is a point of convergence that actually is synergistic across all of those. So when a lot of us think about how to frame the challenges that health systems face around the world, including here at home, we put it a lot of times around these three core ideas. So the first is access to health and health-related services. So how do we ensure that everyone from an individual to population levels actually get access to the services that they need? The second is around quality. So we know that even in a place like the US, the variability in terms of the quality of services is enormous. And it's even more so in other parts of the world. So how do we actually think about this issue of quality of the services and technologies? And then thirdly, almost every country in the world is struggling with the affordability of health and healthcare services. And if you think of those, and some folks in the policy circles call this the iron triangle, so that this idea that you can take steps to improve one or even two of these, but usually to the detriment of the third. So if you want to increase access and improve quality, that usually reduces the affordability of the services you're trying to provide. So beyond this core challenge of the infrastructure needs, we know that the world's changing rapidly, that the rise of non-communicable diseases is happening even in low and middle income countries that are still struggling with communicable diseases and public health measures, so they have this dual burden of health challenges. At the same time, the world's population is aging rapidly, which is leading to many other challenges in terms of the needs of a health system. We know that the infrastructure doesn't exist in many parts of the world, whether that's human capital or brick and mortar infrastructure or supporting technologies. And so when you think about those daunting challenges, I think if we flip that around to say, how are these opportunities, right? This is really the mindset of a lot of the people that are developing solutions to health challenges. How do we think about innovations? How do entrepreneurs develop innovative models of care, novel workforce development opportunities, as well as disruptive technologies that are all intended to actually break that issue of this iron triangle? So could it be possible that we could actually improve access, increase quality, and improve affordability at the same time? So some of the work we did was to look around the world to see, are there bright spots that we can learn from? And the good news is absolutely. There are dozens of organizations all around the world, low, middle, and high income settings, that are developing and implementing models of care, technologies, workforce development, financing mechanisms, infrastructure and support services that, if we were to collectively scale and replicate, could be transformative in improving the health system. Just a few quick examples of these. In India, we have LifeSpring Hospitals that's now got a chain of over 15 facilities that's providing midwife-driven delivery services for 1/3 of the price point of the rest of the private sector. Or you have Jacaranda Health in the outskirts of Nairobi that's providing maternity and child care for populations that wouldn't have access to quality services otherwise. We've got One Family Health we're going to talk about a bit more in depth later this morning, that's based in Rwanda and is empowering largely women nurses to own and operate their own microclinics in sub-Saharan Africa. And we have Medical Home in Mexico that's providing 24/7 access through a call center model to nurses or physicians that are able to answer over 60% of questions over the phone. And so all of these are different mechanisms of trying to improve health systems along the way. So what do we learn from studying these types of innovative models? What is it that they have in common? First is that they're based around the patient, not the provider or the consumer or end user or the community. So really getting to understand what our consumers or patients need and building our services and products around those needs, which usually means not building a clinic or not building a hospital and hoping somebody will come to you when they're sick. The second is actually using proven technologies disruptively. And here, I'm not talking about ultrasounds and MRIs. I'm talking largely about mobile phones. It's the most ubiquitous technology in the world now. And if we can think about mobile phones as the vector through which to get to some of the most vulnerable populations in the world, we could have tremendous impact. The third is a lot of, fits right into what we're talking about even more so today is we've got to get past some professional assumptions, guild mentalities to really think about task sharing, task shifting, right skilling, whatever term you want to use, but it's really about making sure that we build competencies in a health professional workforce that are appropriate for the needs from a health system. Standardization. We know from almost every other industry that increasing standardization and reducing variability leads to higher quality. We know this from automobiles. We know this from lots of other manufacturing, and we have more and more data that this is the same in healthcare. So how do we get to a point where we're standardizing more than we do today? And finally, how do we think about borrowing somebody else's assets so that we're not investing huge amounts of fixed capital? So I mentioned Medi-Call Home as a call center model. They're not built as a health system. They didn't build brick and mortar. They didn't even build their own infrastructure. So they actually overlay their service on top of the mobile phone service in Mexico. So how can you leverage assets, resources that other people, not just in the health sector, but across sectors have developed so that we can actually start piggybacking health-related services on top of that? So those are some of the key aspects of how these different organizations around the world are actually improving health and healthcare. At the same time, we know that these aren't models that are ubiquitous, and so there's something that's preventing their scale and replication around the world. And when we look more closely at it, some of this has to do with knowledge and networking. So the world's health innovators don't have access to each other. So creating a network where knowledge can be shared, people can address shared challenges together, provides tremendous understanding of potential challenges and solutions along the way. The second, these are largely small and medium enterprises that don't always have the full spectrum of organizational capabilities needed to continue to grow. So everything from understanding how to do strategic planning to how you recruit and retain the best talent as you continue to grow, to understanding things like unit economics as you scale, are all challenges for these small organizations. Access to funding and capital. So I know Beth is going to solve this one for us in a few minutes, but almost any organization has challenges in continuing to get access to funding to continue to grow their work. And then finally, how do they actually interact with the ecosystem? So how do you work with the public sector? How do you work with the incumbent players? And how do you navigate this as a small or medium enterprise, as an entrepreneur? So these are some of the challenges that we see. So putting together what we're seeing from a health systems strengthening perspective with this other convergence from impact investing, women's empowerment, part of the conversation from the workshop was around how could you develop a potentially unifying framework. So I'll provide my perspective, which is informed by a lot of the input and a lot of the conversation that's happened over the last few months. But really at the middle of this is the idea that we need to strengthen health service delivery organizations that leverage the expertise of nurses and midwives and other health professionals. And these can be focused on providing primary care, maternal child health services, as well as more services over time. And so we need to think about how you would structure such enterprises. They could be franchises, like we'll talk about with One Family Health in a few minutes. They could be co-ops, as we've seen in different models. They could be traditional provider organizations in different parts of the world, or they could be innovative new models in terms of the enterprises themselves. Now, we need to have strengthened development of health professions, especially with a focus on developing women health professionals, whether that's nursing and midwives or community health workers or more broadly, the types of health professions that are going to be needed to manage these enterprises. And at the same time, we have to build an environment that gets access to capacity building and quality development and assurance over time, which is largely around things like accreditation and certification and the ability to continue to build quality and learn over time. Now, all of this has to be underpinned by this idea that we have to build capabilities in innovation and entrepreneurship. I know that may sound vague, but understanding not just how to care for patients as you're in developing nursing education, but how do you empower your nurses to become change agents, to actually understand how to manage teams and programs and budgets so that they can actually manage and lead these organizations over time. Now, we've got to fund all of this, of course, and I think there are creative ways to think about access to different types of funding. So for the enterprises themselves, they can rely on everything from debt and equity to user fees for the services they provide. For the health professions development, that can rely on donor funding, student loans to some extent. For the actual capacity building, both donor funding and fees from the provider organizations or the service organizations would make sense. So thinking about the various financing mechanisms that will lead to a model of sustainability across the ecosystem is critically important. And of course, this is largely focused on the supply side, so we also have to think about the demand side, which means we have to come up with ways to communicate quality so people know which facilities or services have quality or not. We have to think about financing and access to insurance schemes and other ways to make sure that the people who need services get access to services. We also think about how you develop networks from these types of organizations, ensure that there are appropriate regulatory frameworks that facilitate appropriate scope of practice of these health professionals. And there's a part here where we think there's at least a role for the appropriate governance that has to involve both the public and private sector and some sort of coordination, because this is a very complex ecosystem to try to develop over time and will have to be done in a phased way and with a vision that's created here with the appropriate intersection of public and private sector. And the last piece of this is that we really have to rely on strong metrics and evaluation so that what we're building is, in effect, a learning health system, that it's able to measure data, that it builds accountability, and we improve performance over time. So this, again, is a starting point for discussion. We'd love to get feedback from others here and over time. And so I will end here and look forward to being part of the rest of the conversation. Thank you.